Hi and welcome back. This video is to show you the bony landmarks that we use to measure to find vertebral levels where our central rays will be placed for different x-rays of the thorax and torso. So the first one I wanted to show you was the vertebral prominence. The vertebral prominence is the spinous process of cervical vertebra 7. So I have him in a lateral, and we're going to count off the vertebra. This is C cervical vertebra 1, C1, C2, C3, C4, C5, C6, and C7. And this posterior projection here is the spinous process of C7. We call it the vertebral prominence of C7. The vertebral prominence of C7 lies at the level of cervical vertebra 7 and thoracic vertebra 1. So between C7 and T1. All right, now I'm going to turn him anteriorly. We're going to look at the next landmark, which is the jugular notch. The jugular notch is the top of the manubrium here, and the jugular notch lies at the level of thoracic vertebra 2 and 3. This is the manubrium. Then working our way inferiorly from jugular notch down to the joint between the manubrium and the body of the sternum. That is, we call that the sternal angle. The sternum sticks out a little bit right here at this area. The sternal angle lies at the level of thoracic vertebra 4 and 5. Then working our way more inferiorly to where the xiphoid meets up with the sternal body, right here at the xiphosternal joint. All right, this little blue part down here is called the xiphoid. The very bottom of the xiphoid we can palpate. It is called the xiphoid tip. The xiphoid tip lies at thoracic vertebra 9 and 10. Now working our way more inferiorly, we've got the lower rib margin. So we can measure the lower, we can palpate the lower rib margin where the costal cartilage is to find the level of lumbar vertebra 2 and 3. This is lumbar 5, 4, 3, 2. So you can see where it's right at the level of those lower rib margins, right? Lower costal margin, lumbar vertebra 2 to 3. Now more inferiorly is the iliac crest. It's the very top of the ilium. It's called the iliac crest right here. That lies at the level of lumbar vertebra 4 and 5. The level of lumbar vertebra 4 and 5, the iliac crest. Now I'm going to turn our patient so that we can see the next landmark we're going to talk about is the anterior superior iliac spine. It is this area right here where the ilium protrudes anteriorly. Anterior superior iliac spine, also known as the ASIS. That lies at the level of sacral segment 1, S1, the very first segment of the sacrum. All right, now we're going to work a little bit more inferiorly here, right, and find what we call the symphysis pubis. The symphysis pubis is where the pubic bones articulate. So the symphysis pubis is in fact a palpable landmark, a landmark that we can palpate, but pretty sure our patients don't want us to palpate their symphysis pubis, right? And I'm pretty sure we pretty much don't want to palpate it either. So what we use is the greater trochanter. So the greater trochanter is on the femur out here, and it's shaded in yellow here, if you can tell the colors. Actually, I can label it here for you, the greater trochanter. All right, so you can see how the greater trochanter lies at the level of symphysis pubis. So that's much easier for us to palpate. We can place our hand on the side of their leg, ask them to move their leg in and out, and you can literally feel that greater trochanter moving back and forth. And it's an easy way to find the level of symphysis pubis because they use symphysis pubis for measurement of central rays on a lot of the positions that we'll be learning down here in the pelvic region. Okay, and then working our way inferior from the symphysis pubis and greater trochanter is the ischial tuberosity. The ischial tuberosity is posterior, right? It's the ischium. All right, this ischial bone here, that most inferior part of it is called the ischial tuberosity. It is a palpable landmark. It's known as a palpable landmark, another very awkward area to palpate someone. So it's something that that's not really a landmark that we use. We really don't utilize that one. I think really the lowest one we'll be working from is the symphysis pubis. We'll be using that one a lot for measurements. Now, as we start learning the extremities, you can see that there are many different landmarks and structures that are highlighted here in our extremities. We'll be learning that. Eventually. So we'll be learning a lot more landmarks as we work our way down, all the way down to the toes, to the tips of the toes. So a lot of things on the knees to learn, a lot of landmarks in the elbow region. We'll be learning these landmarks here at the shoulder, landmarks to find center raise for our shoulders and things like that. So there's a lot more to learn. I would like to urge you, if at all, if you can, check out this biodigital human. It's fantastic. It's got so many different resources for you to use that helps you to really look inside the body when we're trying to learn what we're looking for in x-rays. I just think it's an invaluable tool to have, a 3D app where you can take the anatomy and spin it around. So if you don't have something like this, it does allow you some free uses, but to be honest, I think it'll only let you use it 9 times and then they want you to start paying. It is $30 a year, but I'm telling you right now, it's worth every penny as a radiologic technology student because there is no way you can see inside and start turning something around like that without having a 3D app to really understand it. Let me go through these landmarks one more time, all right? We've got the vertebral prominence, the level of C7 and T1, vertebral prominence, all right? Then we've got the jugular notch, level of T2, T3. We have the sternal angle, the level of T4, T5. We have the xiphoid tip, level of T9, T10. We have the lower costal margin, level of lumbar 2 to 3. We have the iliac crest, level of lumbar 4 to 5. We have the ASIS, the level of sacral segment 1. And then we have the greater trochanter at the level of the symphysis pubis. Thank you so much for watching. I hope this was helpful. I'll see you in the next video.